Hey, I'm Dr. Spencer Russell.
And I'm Dr. Alex McRee, and we're here with Jackson Implants and Dentures. So I would say almost every single day we get asked, will my teeth look natural? Are they gonna look fake? That might be the #1 question that we get from any consult. And it's a legitimate question. And today we're gonna talk to you about why does it look fake and why does it look natural? And there's a lot that goes into it. There's a lot of artistic ability that goes into on the lab side and also on the restorative side on where the teeth are set. So it's not just, oh, it's just that's way too white, and they're set wrong or they're too big or something. There's a lot more that goes into it. And so Dr. Russell is going to explain what all those factors are.
Yeah, so I mean, we get it. It's a big investment. You want to make sure you're coming to the right place that's going to have you looking good afterwards. And so we've all seen people out there. We've seen celebrities, presidents, whoever with really fake looking teeth. We call them, they may have horse teeth, they may look like chiclets, anything like that. And everyone wants to know, are my teeth going to look like that? And so we'll kind of dive into the details here about why something may look like that. So a lot of people have seen somebody in a bad fitting denture or a bad looking denture.
And most people show you these great looking teeth, but you have to know what doesn't look good to know what does look good.
Yeah, and so let's just look at this denture here. And so this one, anytime you have a denture made, these teeth are generic, they're stock. You have to buy them from a supplier and then you're gonna set them in this piece of acrylic here. And so when you get these, you could have somebody who has a denture and y'all could have the exact same teeth because they were bought from the same mold, they're bought from the same supplier. And so it's very difficult to achieve something that's natural looking and that's individualized to yourself. So anytime we're doing our full mouth implants here, we're starting from scratch. Everything is fully custom made. And so the very first thing I'm doing in your pre-op appointment is we're gonna take really high quality before pictures so we can see what your current teeth look like. I'm gonna take a 3D scan of your face that's gonna map everything out for us. And then we're gonna take a 3D scan of your existing teeth. Then we're gonna take measurements. We're gonna measure the size of your current teeth. What this is gonna let me do is we're gonna see, does it fit the size of your face currently? Some people are born with really small teeth, some people are born with really large teeth. And you may like that and we can always match that, but if not, we're gonna take those measurements so we can ensure that the teeth that we put in there are gonna fit your face. The other things that we look at are always gonna be the translucency of the teeth. If you end up with these teeth that are just flat white all the way around, it doesn't look natural. And so you'll see it's been a pretty common thing in the past few years for people to get these really blinding white, no translucency. It looks like someone took a piece of gum and just stuck it on there.
And people refer to it as dead. So it just doesn't have that lifelike, because teeth, the enamel is more kind of glass-like. And so our final material, zirconia, is much more like that. So it gives that translucency, and it's the way the light reflects off of it is what he's referring to.
Yeah. And then so there's all these other little things. So when we come into this hand finishing, we have our highly skilled trained technicians come in. Everything's milled out. The computer does the beginning set of the work, but then our technicians come in and do the fine details. So we're gonna come in here, we're gonna open up these embrasures. We're gonna round your line angles here. If you wanted a space in between your two front teeth, we can make that happen. If you wanted sharper canines, any of this stuff we can make happen for you. And then we're gonna see the way it looks based on our computer design before we put anything in your mouth.
And that's a huge step he just touched on. And so I don't want to gloss over that. And it's called green staining. But what that basically means is the depth that he's putting in the teeth, right? And so you've seen it right there. And so that's what we talked about with chiclets, is that everything looks like it's one tooth. And so it's the right shade, right? The teeth are set in the right place, but it just doesn't look right. Something's not right. And so what he's talking about is that definition, because teeth are in 3D, right? I mean, everyone's teeth are, have depth in between. So when he says embrasures and line angles, that means he actually goes in and carves out so it looks completely natural. And that is a huge step and takes someone with a lot of experience and a lot of artistic ability to be able to do that. And we do that for every single case here.
Yeah, and so that's really what sets it apart. Anybody can make something and then send it to the computer and then the milling machine is gonna mill it out here. But it's just not gonna give you that next step up, that next level of aesthetics to really set yourself apart and for it to really look like when you go out and smile, someone's gonna say, oh, those look really good. It's not gonna be like, oh, where'd you have your work done? They're gonna say, man, your smile looks really great. So we believe this is what sets us apart and what everyone should be looking for and will achieve if you come and see us here.
And that's just the teeth. And so what he didn't even touch on was the actual gums. And so you can see here, this is what it would look like maybe before the gums are actually on there. And additionally, that's what he's showing there. And so a final product would be something like this. And so there's different ones. You can do composite. You know, for our temps, sometimes we'll do that. But for a final, we actually do just kind of a liquid ceramic. And what that does is it doesn't allow it to catch stain over time. So that way, not only does it look natural, it will stay looking natural. And that's where, again, a lot of artistic ability comes in, because you have to take this right here, which is monochromatic, and that's what this was as well, all single shade, and make that look like teeth. And so that's where it's such a big deal to have the right place do that for you. And I'm not saying other people can't do it, they certainly can, but they definitely have to take a lot of pride into it. And if they don't, that's where you're seeing those pictures or those people that you see, you know, online or even in person and go, you know, they look good, but something's not right. And so that's where that difference is the next level to make it look where what we want is someone to look and say, that's a very nice smile, and that's it. There's no questioning of, is that a fake smile? It's just, that's a nice smile, and that's all that you think about.
And so you briefly touched on it. I want you to kind of go into a little bit more detail. So with our zirconia, our full ceramic here, it doesn't stain. And a lot of people come in and say, well, like, oh, I'll pick the lighter color so that way in a few years it'll get darker. Now, kind of touch on the difference between the zirconia versus the acrylic or a composite, something like that.
Yeah, there's different materials. There used to be some, like basically a denture over a titanium bar. There's some nano ceramic materials out there, and there's zirconia, and there's acrylic for a denture. And so it's just more porous. And so think of it like, they're all strong, right? And so think of it like a Glad or like Tupperware. You know, you put some spaghetti sauce in there and then you clean it out, but it's still red. It still stains. It's because inherently there's just like little micrographs in everything, and so stain's gonna get in there. Whereas this is more like a glass ceramic. So again, much like a glass, if you were to put tomato sauce in a glass, you rinse it out, it looks brand new. So that same exact principle applies here.
Yeah, so that's one of the most important things for our patients is we want you coming in, we're gonna give you these final permanent bridges here, and I want this to look the exact same way it does 5 years from today, the same way it did today. So.
And another way that we ensure that, just to touch on one last thing here, is that, you know, we will give you obviously your temporary either the same day or the next day, but we also provide unlimited temp changes. So if someone says, you know, I really like this, but there's just something I want different, we do not charge extra for that. We get it until you are exactly perfectly happy with what your teeth are before we go to finals here. Yeah. And so now you know what makes teeth look fake and what makes them look real. So I'm Dr. Alex McRee.
And I'm Dr. Spencer Russell.
Thanks for watching.